My name is Lynn Weston. I'm a general surgeon with a subspecialty in colon and rectal surgery. I've been in practice since 1996. The first 10 years or so of my practice, I did the full breadth of general surgery. In the last 10 to 15 years, I've had more of a specialty in colon and rectal surgery, but I still do a lot of general surgical operations. My office is located at Scripps Clinic, Torrey Pines, and I do all of my surgery at Torrey Pines. I do a lot of rectal cancer surgery and colon cancer surgery. I specialize in surgeries for inflammatory bowel disease like Crohn's disease and ulcerative colitis, and for diverticulitis. And then I also do the full breadth of anal rectal procedures, which could be things for hemorrhoids or anal fissures, fistulas, abscesses, or complex tumors around the anus. People often ask me why I chose colorectal surgery as a subspecialty. I think thinking mostly of the rectal part of the specialty. I think I chose it because a lot of patients that have those diseases are seriously ill. The disease processes are complex, and the surgeries required to fix the problem are often a little more complicated than some of the other general surgical operations. And I find it satisfying to be able to help those people get back to their life. In the length of my career, I've actually seen the entire process and change from open surgery to laparoscopic surgery to robotic surgery, which is a computer that helps us operate. Knowing the full breadth of both the technology and also being able to fall back to open surgery when that's necessary and being confident and comfortable with that, I think is a real advantage for me and my patients. A lot of times people come to my office and they tell me they want a surgery done with a robot, for instance, but I think it's important for them to realize that sometimes it might take me more incisions and more time to use the robot than it would to perform their same operation laparoscopically. So I try to use technology where I think, as I said, that it adds value to the patient. One thing that I think is a real advantage for both patients and for myself as a physician is that my colleagues in the other subspecialties at Scripps are really easily accessible to me. It's easy for me to call them on the phone, send them a message in the computer, or even sometimes walk down the hall and just knock on their door if I have a question about how best to manage a patient in terms of some of their other medical problems, for instance, or other issues that might impact their surgery. I think Scripps is an excellent choice for patients because I know that we're really focused on providing the highest quality of care. I try very hard to treat people as if they were the doctor and I was their patient, to try to treat them the way I would want to be treated.